Hello again, guys. Hope you're all doing well. I'm actually recording this on the night of the last video that I made on the 13th there. This is a topic I've been really wanting to talk about and do a video on, and I had some time this afternoon to do some extra research and kind of put it all together so I could present this to you. I'm going to be releasing this on March 14th, though, so even though it's technically March 13th, the date on this video will be March 14th. And the topic we're going to be talking about today is safe quarantining or effective quarantining at home. Just a quick thing I want to go over if you are joining us. Recently I've noticed there's quite a few new subscribers to this channel. Thank you, welcome, thank you for watching. Just really briefly, a little bit about myself. I don't want to present myself or frame myself in any way that would be misleading to you. I'm not a doctor. I'm not an expert, although I feel like I'm getting there on COVID-19. I'm someone who's followed this very closely for the last 7 weeks now. I live in China, in the north part of China, and as soon as this news broke on the coronavirus there in Wuhan, I was really carefully reading everything that I could, especially Chinese data coming out of China. I've been here in China for 11 years now, and I've seen what this has done to China and China's reaction to it. And very early on, I was seeing a pretty big discrepancy between the way China was handling it and the way the West was presenting China's handling of it. A lot of things were mixed up. And then seeing this kind of spread across the world, there's just been a lot of mixed messaging and a lot of misinformation actually coming from even major media organizations. So that's why I've continued making these videos. So let's talk about this safe quarantining in the home. So let's just go over some numbers first of all. It is estimated currently that there are 300,000 available hospital beds there in the United States. I'm not sure about other countries. I'm really kind of tailoring this to my American audience because my friends and family mostly live there. So 300 beds there, 300,000 beds rather, there in the United States. Now, how long will it take to fill those 300,000 beds? It might seem like a long time, but actually, given the rate of growth of the coronavirus, which is about a doubling every 6 days, it's been estimated that all of those beds will fill up by the first week of May. So that's only about 6 or 7 weeks away from now. It progresses very quickly, and that's what we're seeing now in the US, where it was going up by 1 or 2 a day, and then suddenly a dozen, and then 100, and now it's going up by hundreds a day. So it's very likely that within the next week or so we'll get to 10,000 cases, and we have to remember that those are 10,000 reported cases. We've said this before, that those numbers that we see, we can't focus in on too much. We can gather a general idea of where the data is going, or a general curve, or what that exponential growth is doing, but we can't definitively say that there are only 10,000 cases in the US or only 1,000 cases, because those numbers really just are a reflection of what we know of the infected cases. There are likely many more that we just simply haven't tested for. So those numbers will continue to grow, and according to these estimates now, the beds will be filled by the first week of May. So what does that mean? Well, it means that very likely in the coming weeks and months, it's going to be necessary to have sick people in your home, family members that have contracted COVID-19. Hopefully they're not in serious condition and don't require medical assistance. They don't require hospital beds or staying in an ICU with a ventilator to help them breathe. But whatever the situation is, it's likely that some of our family members will get sick with this. Now, we have to think about the implications of something like that. If we're a generally healthy family, if our household all has very robust health, we're fit, we're active, we have very active immune systems, then we'll probably all be okay. But in many households in the United States, that's not the case. You may be living with aging parents or grandparents. It may be that you have people in the home that have these so-called comorbidities, or extenuating circumstances that would make their bodies more susceptible to high risk, these more high risk to these infections, such as pneumonia or other complications. So how can we quarantine the home in a safe way, making sure that the sick people, or hopefully just one person in the household, is kept completely separate from the healthy population? That's the topic of this video. So first of all, let's talk about what quarantine means. What we're really talking about here when we say quarantine, and sometimes the terms are kind of mixed up a little bit. What we're talking about quarantining is someone who does have symptoms, someone who is sick with COVID-19 or is suspected to be sick. Maybe they can't get a test, but you're pretty sure they've got it. How to keep them separate from the healthy population in the family. Now my suggestion here is going to be to start thinking in this direction. If you've been watching my channel for a while, if you've been keeping up with these videos, you know that I have always tried to stay mentally a few steps ahead of where this is going. And unfortunately, just because of seeing how this has unfolded in other countries, a lot of those things that we talked about before, for example, getting your life ready to be online, getting work and school online, cutting back on expenses, disinfecting your groceries, all of these things that we talked about in the past are now becoming more and more commonplace. So this is, again, a thought that's going a few weeks, ahead, thinking ahead what's going to happen. But if I was there in the United States, I would definitely start making preparations for this. Even if I didn't have someone elderly in the home or someone with, serious health serious pre-existing health conditions in the home, I would consider doing this just in case myself or my wife got sick. That way we can keep the other person healthy, just to be cautious. So again, this might be a little ahead of the curve, but something to think about. Now, it is not going to be expensive to do these things. I went online and I calculated the cost, and it comes to about $40 for all of this stuff, so it's really not going to hit the bank too much. And here's the supplies that you're going to need for this. First of all, you're going to need masks, eyewear, and gloves. These are things that hopefully you can get them now. Hopefully you already have them. If not, as you know on my channel, I've talked about how to make your own masks, which are effective. They're about 70% as effective as a surgical mask, so it's definitely worthwhile doing this. Regardless of the circumstances that you're in, go ahead and make those masks, because you don't know when you're going to be able to, when you're going to need them. Another thing you're going to need is disinfectants, which you probably have already purchased, things like ammonia, bleach. If you're going to be making a bleach solution, the CDC recommends 5 tablespoons, which is a 1/3 cup of bleach per gallon of water, or if you're doing a smaller amount, 4 teaspoons of bleach per quart of water. And that gives you a very effective solution that can kill the virus. Another thing you're going to need is polyethylene sheeting, just clear plastic sheeting, and I recommend something transparent, not something opaque like Tyvek, and the reason for that I'll get into in a little bit. But you want something, in my opinion, you want something transparent, something you can see through, and plastic, and something that's a little bit heavier. You don't want something that's going to be very flimsy or would tear easily. You also need some sort of duct tape or masking tape, and also a separate waste bin. This is very important. You're going to want a separate waste bin with a cover for the quarantine area. So total, all these supplies come out to about $40 US. You can get most of these things at your local hardware store, at your Home Depot, a place like that, or you can get it on Amazon, and I'll put a link to that polyethylene sheeting below. It comes out to about $25, not very expensive. So let's go over, first of all, what this kind of quarantine situation would look like in the home. So this is just a picture I found online of a typical hallway setting. Your home probably will look different than this, but in this diagram here, this is going to be the bathroom here. This door here would be a bedroom. And the way that I'm recommending setting this up here would be like this. So in this diagram here, you've got the plastic polyethylene sheeting here. This would be taped along the sides of this doorway here so that there's no flow of air coming through there. Also taped on the floor. You'd want to have a little bit of extra plastic here so that you're not just taping the edge right against the wall. You want a little bit extra. Duct tape probably for the floor. You could duct tape the walls, but of course that would probably ruin your wall. So masking tape, preferably something like 2 or 3 inch masking tape to make sure you get a good seal around here, should be sufficient. And then here a door. It kind of looks like a doggy door. And we'll explain why it's positioned so low here. And that would also need to be sealed probably with masking tape around all the 4 edges. With a hinge at the top, you could use duct tape just because it's a little bit stickier, a little bit stronger than masking tape. So basically what you're doing here is you're just creating a barrier with this plastic between the inside and the outside. The inside having access to its own bathroom if you have a separate bathroom in the home, and the bedroom where this person, the sick person, would be staying in. So if you wanted to look at this a little differently, you could see this as a red zone and a green zone. The green zone being where the healthy members of the family would be staying, and the red zone being where the sick person would be staying. So going over some of the details of this, why would we want it to look something like this? Well, the first principle of quarantining would be limiting contact. Now that would mean really all contact. You don't want to be eating a meal together. You don't want to be using the same bathroom if you can at all avoid it. Of course, not all homes are going to have multiple bathrooms. If you are sharing a bathroom, it is recommended that you clean the bathroom, you disinfect the bathroom thoroughly after the sick person uses it every single time. That is the only way to guarantee that you're really killing that virus sufficiently. You'd want to wipe down everything, any surfaces that could be touched, and really even surfaces that may not be touched, because the person's breathing, the person's coughing, that can be getting virus everywhere. We've talked about on this channel just how easily this thing spreads, how long it can stay in the air, and how long it can survive on surfaces. So everything needs to be disinfected. Of course, limiting that contact would also mean that you wouldn't want to have any physical contact with the person. Now, this doesn't mean not socializing, and that's where we come back to having this transparent plastic. This is going to be something very important and something that we experienced firsthand here being in quarantine. Now, we weren't sick, but we were quarantined from the rest of the public. We were not able to go out. We were not able to see any other humans, basically, for 2 weeks, other than each other. And that takes a toll. It takes a toll on your psyche. It takes a toll on your mental and emotional health. So if you block someone out and you put an opaque wall between you and them, they're going to feel that isolation even more. And as we all know, the greater your stress is in your body, the lower your immune system goes, and the easier it is for you to develop even more serious illness. So you want to keep that person's spirits up. You want to make sure that they're getting that human contact, even if they can't physically be touched. So having that plastic wall that's transparent will allow you to talk with them. If they're well enough, perhaps they can set up a chair or recliner inside that wall. You can set up a chair outside. Maybe you can watch a movie together. Maybe you can even play cards together, or at least talk to them, and that way they have that human contact, which is going to be so important for a lengthy period of quarantining. Now, let's talk about this door that we had in this diagram here, this door at the bottom. Why do we put that on the bottom? Well, when you're handing things to the person, such as food, their meals, through the door, or you're getting their laundry from inside the red zone, you're going to want to make sure that you're not touching them unnecessarily. So this door allows you to open it, kind of put the things inside, and then close it so they can grab it. It's kind of like a prison setting. I know it sounds really draconian, it sounds kind of awful and morbid, but this is likely what's going to happen in some households. So again, just thinking ahead so that when it happens, it's not so sudden, it's not such a shock to the system, and you can kind of deal with it rationally. So just some things to keep in mind. As far as disinfecting, if it's possible, if the person is physically capable of disinfecting their own room and their own bathroom, that is preferable. Otherwise, you're going to be needing to enter into that red zone yourself, and you're going to need protective gear. As it's up to you how far you want to go with that, obviously, but the more gear, the better. And this quarantine could last for a while. It could last for weeks, even up to a month. So it's going to be likely, the longer it goes on, that you will have some kind of cross-infection. So it's best if the person inside can be disinfecting their own personal space. Also, if you do need to go in for some reason, if they're not well enough to clean their own bathroom, then in that case you'd obviously want to make sure their door is shut so that you can get in there, and then you have less air going back and forth. Now, something related to disinfecting, and this is the third point, is waste disposal. And this is why it's so important to have a separate waste bin for the person inside the quarantine zone, inside the red zone. It's recommended that you have a waste bin with a lid on it that, again, will keep the viruses somewhat contained. Also, the trash should be double bagged. And just something that would be, a word of just kind of consideration for your sanitation workers, your garbage men, consider spraying down. If you've got that spray disinfectant, spraying down your garbage before you tie it and toss it out. Because the last thing we want is the sanitation workers to be going through garbage and then get infected because they're touching some infected person's waste. So just something to keep in mind, that's just kind of considerate. Again, that trash is going to need to be double bagged. That just puts an extra seal and keeps it as safe, and you want to get that trash out of the home as soon as possible. The next point is laundry. How do you deal with laundry? Well, this comes directly from the CDC, and I'm going to put a link to the CDC's website. A lot of these points I'm going over, they've also gone over. on the website about how to care for someone at home that's sick. The CDC recommends washing clothes of an infected person with the warmest water settings possible on your washing machine. It also recommends handling all of their laundry and linens with gloves, preferably disposable gloves. If you don't have disposable gloves, then you could reuse gloves, but you'd want to disinfect them thoroughly, and it'd be best to have a dedicated pair of gloves just for dealing with that person's waste, for dealing with their laundry, and any kind of cross contact with that person's belongings. You'd probably want to use gloves. Another thing that it mentions, and this is hard, this is something that's going to go against our natural inclination, but not shaking out the laundry. So sometimes when we get laundry, we shake it out before we put it in the washing machine. You're going to want to not do that, because again, that could put those virus particles in the air, and you could breathe them in. They could land on surfaces, people touch them, touch their face, and now quarantining is all for naught. So something to keep in mind, being very, very careful with the laundry, with their waste, anything that they've touched. The final thing on this, the principles of good quarantining, is air pressure. Now, you may have heard in many of these rooms that are treating people with the COVID-19 that they have negative air pressure rooms. A negative air pressure room looks like this, and basically it is what it sounds like. It's a vacuum. It keeps the air from flowing out of the room and getting other people in other hospital rooms sick, or other parts of the hospital sick. So it pulls the air from that room into a special dedicated vent, and from there the air is processed and cleaned. Now, it's not entirely possible or feasible for us in the average home environment to set up a negative air pressure room, but knowing the danger of positive air pressure alerts us to one possibility, and that is that if you're going to air out the home, don't do it on a windy day. Why not? Well, if you have ever opened your windows on a windy day, you can feel that breeze going through your home, and that is exactly what you don't want if someone is infected with this thing in the house. So airing out the house is good. You're going to want to do that when it's not windy, when it's very still outside, so that the air can clean out the home without pushing infected air through the home. That's going to be very important. Now, there's another thing you might want to keep in mind, although I'm going to say this with some caution, and that is that if the person is able to be quarantined next to a dedicated bathroom, as we saw in the diagram that I made here with the hallway, if they're adjacent to a dedicated bathroom, that bathroom may have a ceiling-mounted bathroom exhaust fan. Now, most homes in the West, they have this. It's able to, to pull out the steam in the bathroom so that the bathroom doesn't get moldy. But just a word of caution here, you're going to want to make sure that that vent is not connected to the rest of the ducts in the house, and also that that vent isn't going directly into your attic. So with some homes that are, where the ducts are put in very poorly, the vent from the exhaust of the bathroom goes directly into the attic. Now, obviously, that's going to create a lot of other problems with the virus aside. But if you do have someone that is being quarantined in a room and you're pulling that air out to create that negative pressure, and it's going into your attic, that's not a really sanitary or safe condition for the rest of the family members. So you're going to want to make sure about that vent that it's going outside, preferably to the roof and not out the wall into your neighbor's window. So just something to keep in mind, but that might be one way to create that negative pressure environment. In any case, just don't open your windows on a windy day. That's going to be very important. So that's basically it. That's going to be what to keep in mind. Now, every home is going to be different. Every setting is going to be different. Every environment, your needs are going to be different. But if you follow these steps, you're in a pretty good position to keep that virus in one part of the home and not infecting other people. Again, if you have family members that are high risk, if you have maybe someone that is young and healthy that gets this and they're going to recover very quickly, but you're also living with your grandfather or your mother or father who have these pre-existing conditions, this is probably going to be your best option. If you want some more information, I'm going to put some links to the things I talked about in the video description. One is that Amazon link that goes to the polyethylene plastic sheeting. I'm also going to put a link to the CDC article about how to care for someone in the home that has this. And finally, the last link I'm going to put in there is a link to the statisticians who are talking about how fast these hospital beds will fill up. So hopefully, again, this was useful to you. I know it's kind of scary talking about these things, but it's good to start thinking about them and sort of getting used to this idea, because very likely this is going to be our lives for the rest of the foreseeable future, for the next few months, possibly the next year. So as always, Thank you for watching. Please stay healthy and stay safe out there. We'll see you next time.